Hello, and welcome to Health Insight with Helen. I'm your host, Helen, a teen health journalist passionate about making health education simple, honest, and useful for everyone. Today's topic is one that's often overlooked but incredibly important: colorectal cancer. It's the third most common cancer worldwide, and yet so many people don't know how to detect it early or how to reduce their risk. To help us understand more, I'm honoured to be joined by Professor Henry, a respected medical researcher and specialist in gastrointestinal health, with over 30 years of experience in the field. So, Professor will be discussing about what colorectal cancer really is, the warning signs to watch out for, and the steps you can take, no matter your age, to protect your health. So stay with us. This is an episode you don't want to miss. Professor, thank you very much for having me.
Good afternoon. Thank you for having me. I'm glad to be here to discuss such an important topic, one that is often overlooked but critically important and increasingly concerning on a global scale.
Professor, thank you so much for joining us today. I recently came across your impressive body of work, including your systematic reviews, meta-analyses, randomized controlled trials, and long-term cohort studies, all conducted while also serving as a full-time physician at a busy tertiary care hospital. That level of commitment is truly rare among clinicians. Could you share with our audience what drives your dedication and perhaps offer some inspiration to those watching?
Thank you, Helen. It's a pleasure to be here. I've always believed that research and clinical care should go hand in hand. My dedication comes from a deep desire to not only treat patients, but to contribute to knowledge that can prevent suffering on a larger scale. Every patient I see reminds me of the gaps we still need to fill in our understanding of disease. That's what keeps me going. The hope that what we learn today will improve someone's tomorrow. And to the young people watching, if you're passionate about something, never let a busy schedule stop you. Make time, stay curious, and let your purpose guide your path.
That's truly inspiring, Professor. I think what you said will really resonate with our viewers, especially young people who might feel overwhelmed balancing their studies, passions, or future careers. Your journey shows that purpose and persistence can go hand in hand, even in the most demanding professions. Now, let's dive into today's topic: colorectal cancer. To start things off, could you help us understand what exactly colorectal cancer is, and why it's becoming such an important public health concern?
Absolutely, Helen. Thank you for that great question. Colorectal cancer is a type of cancer that starts in the colon or the rectum, which are parts of the large intestine. It typically begins as a small growth called a polyp, and not all polyps are dangerous, but some can slowly turn into cancer over time if they're not detected and removed. One of the reasons colorectal cancer is so concerning is that it often develops without any symptoms in the early stages. That means many people don't know they have it until it's already more advanced and harder to treat. However, the good news is that it's one of the most preventable and treatable cancers if caught early, thanks to screening methods like colonoscopy. Unfortunately, we're seeing an increase in colorectal cancer cases in younger adults, people under 50, which was not as common in the past. We're still studying why this is happening, but lifestyle factors like poor diet, physical inactivity, obesity, smoking, and even gut microbiome changes may all play a role. Genetics can also contribute, especially if someone has a family history of the disease. So, in short, colorectal cancer is serious, but it's also very beatable when we raise awareness, encourage regular screening, and promote healthy living. That's why conversations like this are so important.
Thank you for explaining that so clearly, Professor. It's eye-opening to hear how colorectal cancer can often go unnoticed in its early stages. You also mentioned that younger adults are being affected more than before, which is quite concerning. With that in mind, could you help us understand the global picture? What does the worldwide prevalence of colorectal cancer look like today? Are there particular regions or populations where it's increasing more rapidly? And what factors are contributing to these trends?
That's an excellent and important question, Helen. Globally, colorectal cancer is the third most commonly diagnosed cancer and the second leading cause of cancer-related deaths, according to the latest data from the World Health Organization, WHO, and the Global Cancer Observatory, GloboCan 2024. In 2024 alone, there were an estimated 2 million new cases of colorectal cancer worldwide, with nearly 1 million deaths. Traditionally, the highest incidence rates have been seen in high-income countries like the United States, Canada, Australia, and parts of Western Europe. This is partly due to lifestyle factors, such as diets high in processed meats and low in fiber, physical inactivity, obesity, alcohol consumption, and smoking, as well as aging populations. However, what's alarming is the rapid rise of colorectal cancer in low- and middle-income countries, especially in parts of Asia, Eastern Europe, and Latin America. These regions are undergoing what we call westernization, meaning their diets, behaviors, and urban lifestyles are changing in ways that increase cancer risk. Unfortunately, many of these countries do not yet have robust screening programs, so diagnoses often happen at more advanced stages. Another significant concern is the increasing incidence in younger adults under 50, particularly in countries like the United States, the United Kingdom, and South Korea. Multiple large-scale studies, including those published in The Lancet Oncology and JAMA Oncology, have confirmed that colorectal cancer rates in this age group have been rising by approximately 1 to 2% per year over the past 2 decades. The reasons aren't fully understood, but likely involve a combination of diet, gut microbiome changes, sedentary behavior, early life exposures, and possibly environmental toxins. The positive news is that in countries where screening programs like colonoscopy, fecal occult blood testing, FOBT, or FIT, fecal immunochemical test, are widely used, such as the US, Japan, and parts of Europe. We've seen significant declines in mortality over the last 20 years. This shows the power of early detection and prevention. So, the global picture is complex. While we've made progress in some regions, we're seeing troubling trends in others, especially among young people and in under-resourced health systems. That's why education, awareness, and access to screening must be global priorities moving forward.
Let's talk about risk factors, Professor. What are the key things that can increase a person's chances of developing colorectal cancer? Are there specific lifestyle habits, genetic factors, or medical conditions that put someone at higher risk?
That's a very important question, Helen. And understanding the risk factors is key to both prevention and early detection of colorectal cancer. Broadly speaking, we can divide the risk factors into 2 categories: modifiable and non-modifiable. Let's start with the non-modifiable risk factors, the things we can't change but should be aware of. Age. The risk increases significantly after age 50, although, as we've discussed, cases are now rising in younger adults as well. Family history and genetics. If someone has a first-degree relative, like a parent or sibling, with colorectal cancer, their risk is roughly 2 to 3 times higher than average. Certain inherited conditions also dramatically increase risk, such as Lynch syndrome and familial adenomatous polyposis, FAP. Personal history of polyps or cancer. If a person has had colorectal polyps or inflammatory bowel diseases like ulcerative colitis or Crohn's disease, their risk of developing colorectal cancer is higher. Now, the good news is that there are many modifiable risk factors, things within our control. Diet. Diets high in red meat, especially processed meats like bacon or sausage, are strongly linked to colorectal cancer. Low intake of fiber-rich foods like fruits, vegetables, and whole grains is also a contributing factor. Physical inactivity. A sedentary lifestyle increases risk. Regular exercise has been shown to lower the likelihood of developing colorectal cancer. Obesity. Particularly abdominal obesity is associated with a higher risk. Excess body fat may promote inflammation and hormonal changes that contribute to cancer development. Smoking. Long-term tobacco use doesn't just affect the lungs, it significantly increases the risk for colorectal and other gastrointestinal cancers. Alcohol consumption. Heavy drinking, especially over a long period of time, can increase colorectal cancer risk, especially in combination with other risk factors like smoking or poor diet. Emerging research is also exploring the role of the gut microbiome, the trillions of bacteria in our intestines. There's growing evidence that imbalances in gut bacteria may influence inflammation and cell growth in the colon, potentially contributing to cancer risk. So, while we can't change our genetics or family history, there's a lot we can do in our daily lives to reduce our risk. That includes staying active, eating a balanced, fiber-rich diet, limiting alcohol, avoiding smoking, and getting screened regularly, especially if you're in a high-risk group.
It is very interesting. It's often said that colorectal cancer can be a silent killer, and that's what makes it so dangerous. Many people don't realize they have it until it's already in an advanced stage. Now, Professor, could you walk us through the common clinical presentations or warning signs of colorectal cancer? What symptoms should people be aware of, and at what point should they consider getting evaluated?
You're absolutely right. Colorectal cancer is often called a silent killer because, in its early stages, it can present with few or no symptoms at all. This is why regular screening is so important. However, as the disease progresses, certain signs and symptoms may begin to appear. Let me walk you through the most common ones. One of the first things to note is that symptoms can vary depending on the location of the cancer in the colon or rectum. For example, cancers in the right side of the colon might not cause obvious signs for a long time, while those on the left side or rectum are more likely to result in changes that are noticeable to the individual. That said, here are the most common symptoms to watch for. Changes in bowel habits. One of the most common signs is a change in your usual bowel pattern. This could mean diarrhea, constipation, or a feeling that the bowel isn't emptying completely. Some patients report alternating between the two or just feeling like something isn't right. Rectal bleeding or blood in stool. Another concerning symptom is blood in the stool. This can either appear as bright red blood, which suggests bleeding from the rectum or lower colon, or dark tarry stools, which suggests bleeding higher up in the colon. If you notice blood in your stool, it's important to seek medical advice immediately. Unexplained abdominal discomfort or pain. Patients with colorectal cancer often experience a persistent stomach ache or discomfort, which may feel like cramping, bloating, or a general sense of fullness. Some might also experience unexplained weight loss or loss of appetite, which are also red flags. Fatigue or weakness. Feeling constantly tired or weak is another common symptom in those with colorectal cancer. This could be due to chronic blood loss leading to anemia or just the body's response to the cancer itself. Nausea and vomiting. As the tumor grows and potentially blocks the intestine, it can cause nausea or vomiting, especially after eating, due to the obstruction of the digestive tract. A feeling of incomplete bowel movements. In some cases, people with rectal cancer feel as though they need to pass stool but can't. This feeling of incomplete evacuation can be a sign that the tumor is obstructing the rectum. It's important to remember that these symptoms don't automatically mean cancer. Many of them can be caused by other conditions like hemorrhoids, infections, or inflammatory bowel disease. However, if you experience any of these signs, especially if they persist for more than a few weeks, it's critical to see a healthcare provider as soon as possible. Early detection can make a huge difference in the outcome. And one final point, Helen. Some people with colorectal cancer may have no symptoms at all in the early stages, which is why screening is so important, especially for those over 50 or those with higher risk factors.
All right, we've discussed the symptoms and risk factors, but how is colorectal cancer actually diagnosed, Professor? What tests and procedures do doctors use to detect it, and how do they determine whether a person has it, especially when symptoms might be subtle or not present at all?
That's a great question, Helen. Diagnosing colorectal cancer involves a combination of medical history, symptom assessment, and a series of tests designed to find abnormalities in the colon and rectum. Let's break it down step by step. 1. Medical history and physical examination. The process usually starts with a detailed medical history and a physical exam. Your doctor will ask about any symptoms you've been experiencing, your family history of colorectal cancer or other cancers, and any risk factors like diet, lifestyle, or existing medical conditions. During the physical exam, the doctor may conduct a simple digital rectal exam, DRE, where they check the lower rectum for any abnormalities or masses. 2. Colonoscopy. The gold standard for diagnosing colorectal cancer is a colonoscopy. This is a procedure in which a long, flexible tube with a camera, called a colonoscope, is inserted into the rectum to examine the entire colon. It allows doctors to directly visualize any abnormal growths, polyps, or tumors. If a suspicious area is found, the doctor can biopsy the tissue, meaning they'll remove a small sample to send to a lab for further testing. 3. Fecal tests. Before or during the colonoscopy process, doctors may also recommend fecal tests to help detect colorectal cancer early, especially for people who have no symptoms. One common test is the fecal occult blood test, FOBT, which checks for hidden blood in the stool, a potential sign of cancer or polyps. Another test is the fecal immunochemical test, FIT, which is more sensitive and also looks for blood in the stool. These tests are non-invasive and can be done at home, but if the results are positive, further diagnostic procedures like a colonoscopy are usually required. 4. Imaging tests. In some cases, if the doctor suspects colorectal cancer but a colonoscopy isn't immediately possible, imaging tests like CT scans or an MRI may be used to visualize the colon and other parts of the abdomen. The CT colonography, also called a virtual colonoscopy, is an imaging test that can help identify polyps or tumors. However, if something suspicious is found on imaging, a colonoscopy will still be needed to confirm the diagnosis. 5. Blood tests. While there is no blood test that can definitively diagnose colorectal cancer, doctors may order blood tests to check for anemia, which could be a sign of chronic blood loss from the cancer. Another test, called the carcinoembryonic antigen (CEA) test, looks for elevated levels of a protein that may be present in people with colorectal cancer. However, this test isn't specific enough to be used alone for diagnosis, but it can be helpful in monitoring treatment effectiveness. 6. Staging the cancer. Once a diagnosis of colorectal cancer is confirmed, doctors will need to determine the stage of the cancer, which means how far it has spread. This is typically done with a combination of CT scans, MRI, and sometimes ultrasound to check if the cancer has spread to other organs, such as the liver or lungs. Knowing the stage helps guide the treatment plan. The key takeaway here, Helen, is that colorectal cancer is highly detectable through screening methods like colonoscopy, especially when caught early. For those at average risk, it's recommended to start screening at age 45. But if you have higher risk factors, like family history or a personal history of polyps, your doctor may suggest starting earlier.
Thank you for that clear explanation, Professor. Now, let's talk about the next critical step: treatment. Once someone is diagnosed with colorectal cancer, what treatment options are available? Could you walk us through the different approaches based on the stage of the cancer, and how doctors decide which combination of therapies is most appropriate for each patient?
That's a vital question, Helen, and I appreciate you raising it, because treatment decisions for colorectal cancer are highly individualized and depend on several key factors, particularly the stage of the cancer, the location of the tumor, and the overall health of the patient. Let's break it down by treatment types and when each is typically used. 1. Surgery, the primary treatment for most stages. For most patients, especially those diagnosed at an early stage, stage 1 or 2, surgery is the cornerstone of treatment. The goal is to remove the section of the colon or rectum that contains the tumor, along with nearby lymph nodes. For colon cancer, this might involve a partial colectomy, where the diseased part of the colon is removed and the healthy ends are reconnected. For rectal cancer, depending on how low the tumor is, surgeons might perform procedures like low anterior resection, LAR, or abdominoperineal resection, APR. In some cases, a temporary or permanent colostomy may be needed, especially if the tumor is very low in the rectum. 2. Chemotherapy, often used before or after surgery. Chemotherapy uses drugs to kill cancer cells or stop them from growing. It's often used in combination with other treatments. Adjuvant chemotherapy, after surgery, is given to reduce the risk of the cancer coming back, especially in stage 3 or high-risk stage 2 disease. Neoadjuvant chemotherapy, before surgery, is sometimes used for rectal cancer, especially if combined with radiation, to shrink the tumor and make surgery more effective. Common chemotherapy regimens for colorectal cancer include drugs like 5-fluorouracil, oxaliplatin, and capecitabine. 3. Radiation therapy, particularly for rectal cancer. Radiation isn't typically used for colon cancer but plays a key role in treating rectal cancer. It's often used before surgery, along with chemotherapy, to shrink tumors and reduce the risk of recurrence. In advanced cases, it can also help relieve symptoms like pain or bleeding. 4. Targeted therapy, precision medicine in action. For patients with advanced or metastatic colorectal cancer, we now have access to targeted therapies, drugs designed to attack specific genetic mutations or proteins that cancer cells rely on. For example, if the tumor has a KRAS wild-type mutation, drugs like cetuximab or panitumumab may be effective. Other drugs, like bevacizumab, target blood vessel growth, angiogenesis, to starve tumors of their blood supply. These treatments are guided by molecular testing of the tumor tissue, something we now routinely do as part of personalized cancer care. 5. Immunotherapy, for a subset of patients. In recent years, immunotherapy has shown promise, especially for patients whose tumors have microsatellite instability high, MSI-H, or mismatch repair deficiency, DMMR, genetic features found in about 4 to 5% of colorectal cancers. These patients may respond well to immune checkpoint inhibitors like pembrolizumab or nivolumab, which help the body's own immune system recognize and attack cancer cells. 6. Palliative care and supportive treatments. For patients with advanced or inoperable colorectal cancer, we also focus on palliative care, not just to manage symptoms like pain, obstruction, or fatigue, but to ensure the best possible quality of life throughout treatment. This is often combined with chemotherapy or other therapies. Professor Henry continued, "The key message here is that colorectal cancer is a very treatable disease, especially when caught early. Even in advanced cases, new treatment strategies and clinical trials are giving patients more time and better outcomes than ever before. The best approach often involves a multidisciplinary team, including surgeons, oncologists, radiologists, genetic counselors, and dietitians, working together to create a tailored plan for each individual patient."
Professor, earlier you mentioned that colorectal cancer is largely preventable, which is both encouraging and empowering. Could you help our viewers understand what steps they can take to reduce their risk? What role do lifestyle choices, diet, physical activity, and regular screening play in prevention? And are there specific recommendations for people with a family history or other risk factors?
That's a crucial question, Helen. And the good news is that colorectal cancer is one of the most preventable types of cancer when we apply what we already know from science and clinical practice. Prevention involves a combination of early detection, lifestyle modifications, and for some, medical interventions. 1. Regular screening, the most powerful preventive tool. The single most effective way to prevent colorectal cancer is through routine screening. Why? Because screening not only detects cancer early, when it's most treatable, but it can also prevent cancer by identifying and removing precancerous polyps before they turn into cancer. For people at average risk, guidelines generally recommend starting screening at age 45. If you have a family history, a known genetic condition, or a history of inflammatory bowel disease, screening may begin earlier, sometimes as early as age 40 or even younger. The most common screening methods include colonoscopy, every 10 years, fecal immunochemical test, FIT, or guaiac-based FOBT every year, flexible sigmoidoscopy, every 5 years, CT colonography, every 5 years. Each method has its pros and cons, but colonoscopy remains the gold standard because it allows both detection and immediate removal of polyps. 2. Healthy diet, a strong line of defense. Diet plays a key role in colorectal cancer risk. Studies show that people who consume high amounts of red and processed meats, like bacon, sausages, and deli meats, have a higher risk. On the other hand, diets rich in fiber, vegetables, whole grains, and fruits are protective. Increase intake of leafy greens, legumes, nuts, whole grains, foods rich in calcium and vitamin D. Reduce intake of processed meats and red meat, highly refined sugars, and low-fiber foods. There is also growing evidence that a healthy gut microbiome, supported by plant-based and high-fiber diets, may contribute to lower cancer risk. 3. Physical activity and weight management. A sedentary lifestyle is linked to an increased risk of colorectal cancer. Regular physical activity helps in many ways. It supports bowel function, regulates metabolism, and reduces chronic inflammation. Aim for at least 150 minutes of moderate aerobic activity per week. Maintain a healthy body weight, as obesity is an independent risk factor for both colon and rectal cancer, or avoid tobacco and limit alcohol. Smoking is not only a risk factor for lung cancer but also for colorectal cancer. Long-term tobacco use increases the likelihood of developing adenomas and cancer in the colon. Quitting smoking can significantly reduce your long-term risk. Limit alcohol to no more than 1 drink per day for women and 2 for men. Or avoid it altogether if possible. 5. Manage chronic conditions. People with inflammatory bowel diseases like Crohn's disease or ulcerative colitis have a higher risk. For them, regular monitoring with colonoscopy is critical. Also, controlling diabetes, maintaining low insulin levels, and reducing chronic inflammation through proper medical care can contribute to prevention. 6. Consider genetic counseling if you're high risk. If you have a strong family history of colorectal cancer, or if multiple relatives were diagnosed at a young age, you might be carrying a hereditary cancer syndrome such as Lynch syndrome or FAP, familial adenomatous polyposis. In such cases, genetic testing and counseling can guide the timing and frequency of screening. In rare cases, prophylactic surgery may be considered.
Professor, thank you so much for your time and valuable insights on colorectal cancer. To all our viewers, I hope today's episode helped you learn more about this important health issue. We'll be back next week with another topic that matters to your well-being. Don't forget to like, comment, and share this video to help spread awareness and stay updated with the latest in health. Until then, stay healthy, stay informed, and stay tuned.